Hi, I'm Justin Brochetti from Intelligence Factory, the creators of FairPath. If you're running remote care programs, your nurses and clinicians don't really have time to be full-time data entry staff. Every minute they spend fighting a keyboard is a minute that they're not actually helping a patient. In this short walkthrough, I'm going to show you how FairPath lets you add clean, audit-ready notes to a patient record just by talking directly inside the portal. So here I am inside of the patient's record inside of the FairPath portal. Normally, when I'm tracking a conversation that just happened with a patient, I need to input some notes as far as what this patient experienced or any clinical summaries that need to happen in addition to what's already produced in the transcript. Once I click Add a new note, the next step would be to start typing. Instead, we're going to use the microphone. I click the microphone icon to open voice capture. Spoke with the patient about elevated blood pressure readings over the past week, reviewed medication adherence, reinforced low sodium diet, and scheduled a follow-up call for next Tuesday. FairPath converts that speech into structured text in real time, right inside of the note field. I can check the saved audio button, and when I'm done, I click save. Now the note is attached to the patient record, stamped with who created it and when, ready for a review or an audit. If this note is part of RPM, CCM, or APCM work, it's living exactly where you'd expect to find it when someone asks, what did you actually do for this patient? And notice the audio recording is saved here as well. So instead of a nurse burning out on 2 to 3 extra minutes of typing every interaction, they talk once, FairPath does the transcription, and your documentation stays ahead of your billing. If you don't have something like this today, you're paying for it in either staff burnout or messy charts. If you would like to learn more, visit us at fairpath.ai.